Now, in this section, we'll be dealing with the determination of the age. Whenever we have the bones at our hand, how are we going to determine what is the age of the person? Not with accuracy, of course, but we can still calculate whether if he's an infant, if he's an adolescent, if he's an adult, if he's in his old age. What was the general features that we observe? Now, the determination of the age. The fetus and the infant. The fetus and the infant have their own characteristics, and we have to document them, and we have to keep them in our mind whenever we are calculating the age of the bones that we have at our hand. Now, the child and the young adult. He has his own characteristics. The age estimation in the later ages, they're also dealt in with, and what are the basically particular characteristics that are found in the old age people. For example, the acris senilis, the osteoporosis, all these come in handy whenever we are determining the age of the bones. Now, the fetus and the young infant. The major dating indices are the appearance of the ossification centers in the growing cartilage. So whenever there is a young at our hand, the fetus at our hand, the ossification centers are the main role play that will help in the calculating the almost exact ages of the person. The bones have to be examined with the cartilage. Radiology may provide more information than visual inspection. So that is very important over here. And healthy white boys. So this is the table that is basically focusing on the healthy white boys. At birth, the calcaneus, the fibula is distal, the third toe, and the talus. The femur, the distal, it is at 7 months and is basically compared in with the 13 months angle. And the tibula, the proximal cuboid humerus head, is basically compared in at 6 months, at 14 months, at 7 months, and at 18 months. The 2 months, the capitate, the hamate, and the lateral cuneiform. They basically, there is a third finger that is basically the first phalanx, and the first toe at the second phalanx at the 11 months. Now, when we are dealing with the 15 months, the third metacarpal, the second toe, and the second phalanx, basically they start fusing. And the fourth finger, the second phalanx, and the fifth metacarpal, they start fusing as well at 18 months interval. Now, when we are dealing with the femur, the head and the capitulum and the tibula and the distal ends, they are fusing at the 3 months interval. And at the 12 months, it's basically the second finger, the fourth finger, and the first finger. So this whole table is basically focusing on the fusing at birth, what bones will be fusing together, the calcaneus, talus, femur, distal tibia. At 2 months, what bones will be fusing, at 3 months, 6 months, 7. So even we can calculate the months in ages whenever we have, we know that it is an infant, and we are basically visualizing them through the radiology, what bones are fusing. We can calculate the exact ages of the baby. So this is another table, and is showing all the fusions that are occurring even up till 5 years. The fifth toe and the second phalanx, basically, it starts fusing at this level. So they are different basically bones, and they're fusing, and what are the changes that are occurring that can be dealt in this by even having a look at these tables. They can be quite descriptive. For example, if we take at 2 years and 8 months, the mutegulate majus, that is basically fusing. And if we take a look at the 5 years, the fifth toe and the second phalanx is fusing together. And randomly, if we take at 8 months, the second finger, it's the first phalanx has started forming, the first finger, the second phalanx, and the third toe, the first phalanx. So we don't have to basically memorize all of these things, but we can have a random view, and we can always consult these tables whenever we are calculating the age of the individual. So the appearance of the ossification centers is complete by around 5 years, and after this stage, the fusion of the epiphysis acts as a calendar up to the age of about 25. So that basically comes in handy whenever we are aging the child and the young adult. Now, the skeletal aging in the later years, it also comes into play the eruption of the third molar teeth, that is basically the mainstay over here, and the fusion of the last epiphysis occurs approximately in the middle of the third decade. Now, over here, it is basically the mandible of the infant, and this is the mandible of the adult, and this is the mandible in the old age. So that is basically a comparison between different ages and the skeletal aging. How does it occur? It is very important. So use of the pubic symphysis and the central ribs and the radiology of the cancellous bones. It is very important. Now, aging adults. General markers of the old age are the osteoporosis, the articular surface degeneration, and the osteophytes. Now, these are found in the old age people. The methods are, of course, the macroscopic method, then we have the microscopic method, and then we have the biomolecular method. So the aging of the adult can be established in detail. These are the markers. First of all, we have to basically establish whether he's an aging adult or not. If these markers are present, he's an aging adult. And we can apply all these methods for these purposes as well. Now, regarding the pubic symphysis. Now, if the age range is around 18 to 19, the symphysial face is rugged. It is transversed by the horizontal ridges separated by the well-marked grooves, and there being no distinction in size between the upper and lower ridges. None of the following structures are present: nodules fusing with the surface and demilitating margins or definition of the extremities. So basically, this is when we are talking about an age range which is around 18 to 19. Randomly, if we look at this table and we discuss the age changes that are occurring at 30 to 35, the age range between 30 to 35, it is basically the increasing definition of the extremities, the development and practical completion of the ventral rampart, the retention of some granular appearances of symphysial face indicating the activity has not yet ceased, and the failure of the ventral aspects of the pubics adjacent to the ventral ramparts. No lipping of the ventral margins and no increased lipping of the dorsal margins. So 49 plus, that is basically the aging process that comes into play, and the ventral margins are eroded at a greater or the lesser extent of its length, continuing somewhat onto the symphysial face. Refraction of the face and irregular ossification, disfigurement increases with age. So basically the aging process has all come into play. And we can always refer to this table. We don't have to memorize, but it's just basically a simple general discussion. What are the age changes that happens during the pubic symphysis? Now, the fourth rib evaluates the profile of the osteochondral articulation of the rib and its depth and the profile of the margin. Now, as the age increases, the profile becomes more irregular, with margins go from a V form to a U form, the depth increases, and the sternal insertion is more irregular. What are basically the changes? It's again a table that's for the distinguishing factor. As you can see, as the age goes on, the deterioration basically moves on from a smoother to a deteriorated bone. Now, the surface contours, basically there is a change. The basic changes from the V-shaped, it basically moves on to a U-shaped in the older ages. The rim edges, as we see, they are more rounded in the younger ages. And as we move on towards the older ages, they are sharp with thin walls. The rim contours, they are regular to slightly wavy in the younger ages and irregular with projections and windows in the older ages. Now, the ossification centers are the mainstay to estimating the age of an individual, and so they are of higher importance. And this diagram is basically showing the different ossification centers that come into play whenever we are aging the bones. Now, the auricular surface of the ileum. This is also again of high importance. The granular. Now, what are basically the factors that we are looking for? The age range, of course. Now, the granularity, the transverse organization, the retroauricular activity, the apical activity, porosity, billows, and striations. All of these basically change along with the age ranges. And as we go along and we go on towards the aging process, the granularity is completely absent, the transverse organizations are not present, the retroauricular activity is markedly present at this level, and apical activity is marked, but the porosity may be present, the billows are not present, and along with the striations. So these are basically the changes that happens along with the age of the person. So in this section, basically, mainly we dealt in with the aging process. How do we calculate the age of a person whenever we get our hands on a skeletalized remains and we want to personally basically identify the person with higher accuracy. That was the end to this section. Thank you for watching sqadia.com.